Hi, I'm Dr. Sachin Kathuria. I'm a consultant urologist with Ganga Ram Hospital. Now, I know Government of India has done a lot of things in the medical sector, but there are a few things which we would like to see. One is, a bill which needs to be passed against assault against the doctors. Patients obviously have their own woes and problems regarding their family members and regarding the diseases. But in that heat of that moment where things might not go right for them throughout, they act in a way which is totally inhumanly. And especially when the doctors are, all by themselves, they don't have any security cover. So such acts have to be condemned, and a strong bill has to be passed so that it kind of avoids any untoward incidents towards the doctors, and it also creates that sense of fear amongst the local population that anything which they do against the doctors will go civilly against them. So stringent laws have to be made for such kind of people so that such things can be avoided in future. Second thing which I would like to say is implementation of Ayushman Bharat scheme. I think it's quite a good project to begin with, but in its implementation into larger hospitals, especially those large busy hospitals, are come with a lot of problems because uh, they've got the beds already occupied by individuals who are ready to pay extra amount or ready to pay that amount which the hospital actually deserves. So in our hospital, or as I would understand in other hospitals, they come through a general ward category, which takes a lot of time. So I think this scheme should be implemented in all the other small setups, nursing homes, especially the ones which are registered with Delhi Medical Council. I can probably talk only about Delhi, but especially the ones who are registered, they should be the ones because they would probably cater to the needs of the patients at a very cheaper price, which maybe a bigger hospital might not be able to do because of the cost factors involved regarding the service, regarding the place where the hospital is situated. So this is what I feel that the government of India needs to do. Second, third is they need to promote medical tourism. I know it's being done in Afghanistan, in Gulf countries, maybe Iraq, and probably in African countries as well. But I think they need to look at countries like Armenia, maybe in Russia for that matter, when the quality of treatment is there, but then since they have government scheme projects, again there's a long waiting out there. So since I've been there, I've seen and I've discussed with some of the people. You have a lot of Russians coming here, so maybe those countries is what you can cater. Fourth is maybe opening up hospitals could think of opening up their own primary health centers in villages. Say a big hospital like Ganga Ram, say Max, Fortis, they can think of opening up small centers which gives them basic services. Let that be at hospital's cost, but then they can actually get you a lot of name. The branding will be there, and then you can have a lot of those patients coming over for tertiary healthcare services. Thanks.